Good morning. On behalf of the Border Solutions Alliance and the West Big Data Hub, thank you for joining us today for our lightning talk with Munseob Lee, Assistant Professor of Economics at the School of Global Policy and Strategy at UC San Diego. This morning, Dr. Lee will spend about 15 minutes discussing the findings of his recent paper on the effect of public disclosure on the transmission of the virus and economic losses. We'll then have a couple of minutes for questions and answers from the audience. Dr. Lee, I'll go ahead and turn the floor over to you.
Okay, so thanks, Melissa, for having me, and thank you all for joining us today. So this is a joint work with David and Changtai. So in this talk today, I will talk about the South Korea's experience. So South Korea has been successful in controlling the spread of disease, and the strategy has been summarized by 3 T's: the trace, test, and the treat. So here I'm going to talk about another very important margin, but that has been somewhat ignored in the discussion about the mitigation strategy. So that is the disclosure of the detailed information of the confirmed cases. So South Korean citizens, they have received this information by multiple channels, text messages, and that has been available on the official website, and the citizens use the mobile apps to check this information. So there has been the 2 advantages from this disclosure of detailed information. The first is targeted social distancing. The people could avoid places where the transmission risk is high, so wherever the cases were found. And the second advantage was we call the self-selection into the changing commuting behavior. So people could do their own cost-benefit analysis. So then, say, vulnerable population, the facing the higher health risk, they could decide to stay at home instead of going outside. But this is different from the mandated lockdown. Under mandated lockdown, the people cannot make their own choice. Everyone is forced to stay at home. But under the information disclosure, the people paying the higher cost and then getting the lowest benefit from the going outside are gonna choose to stay at home. So these are the 2 advantages of the information disclosure compared to the mandated lockdown that has been implemented in many countries, including the US. So today I'm going to basically argue that reduced the transmission of the virus and the cost of the social isolation. So this is the example of the public disclosure. So whenever I show this to my colleagues in the US, they are quite surprised by how detailed it is. So this is the one case. It was the second case in the city of Seoul, which is the capital of Korea. So this is the information available on the web that has been distributed by the text message and through the mobile apps. So you basically see the detailed information about the travel log by the confirmed patient. So all the places with a star, those are the establishments whose exact names has been disclosed. Say the supermarket, by knowing this information, the people could basically avoid going there, redesign the travel route. So that has been translated into the map because there is the exact name of the establishment. You can basically you can basically plot the dot on the map. So this is the one of the most popular app that has been used by the Korean citizens, called the Korea map, the Corona map. And this is the snapshot on the February 24th. And you see the dots, and those dots are places recently visited by the confirmed cases. So what do we do in this paper? So we quantify the effect of the public disclosure on the transmission of the virus and economic losses in Seoul. So I'm going to basically show that we use the detailed mobile phone data to document the change in the flows of the people across the neighborhoods in Seoul in response to the information about the confirmed cases. So I'm going to basically minimize my time introducing the model, but what we do is that we analyze the effect of the change in the commuting flow in SIR metapopulation model by endogenizing these flows in the model of urban neighborhoods with the commuting decisions. So then what did we find? So we find that the change in the commuting patterns due to the public disclosure lowers the number of the cases and deaths. And the economic cost of the mandated lockdown is almost 4 times higher compared to the disclosure scenario. So we use the mobile phone data, and you can find the mobile phone data from the US and the Mexico. So I'm basically strongly recommending you guys to use the cell phone data to basically document and understand how the people change the movement behavior, the commuting behavior during the pandemic, sometimes with or without the lockdown. So this is the figure from Seoul. So what is the y-axis? So that is the percent change in the inflows to the district. There are 25 districts relative to the first week of the February. So each dots are representing the change in the average inflow. So you see this is the 20%. So at the basically peak of the spread of the virus, which is the late February in Korea, when then Korea was widely covered by the US media and the other countries, the media. So then the average commuting flow has declined by the 20%. And there is the confidence interval. What is that? So all the 25 districts are not equal. So there are some the downtown district and there are some the bedtown districts. So basically there is some variance. So downtown districts were basically losing the more inflows, and then the commuters town, the bedtown districts were basically losing less of the inflows. But then in Seoul, the people's commuting behavior came back to normal in the May. So this is basically the change in the commuting behavior, the time series. And then if you are interested you can look at my paper. And in the paper, we documented that this traffic declined in the district with a larger number of the cases and the visits. So meaning that whenever people see many cases and many visits in the specific district, so then they avoided going there, or they redesign their travel routes so that they can basically bypass that specific district. So that's the fact from the data. Let me quickly show you how the social scientists, I'm an economist, so how the social scientists are the modeling the spread of the virus and then the quantifying the effectiveness of the different mitigation strategies. So since January or the February of this year, so social scientists are actively following the modeling techniques from the epidemiologists. So this is the standard the modeling framework in the epidemiology, so-called SIR model. So they divide so this is the epidemiology. So they divide the people into the 4 groups: susceptible, infected, the quarantine, and recovered. So some susceptible people can be infected at the workplace. Some of them are tested and detected, and many of them are recovered or dead without being tested. That is basically happening all over the world, including Korea. So this is the epidemiology part. So then what do we do as a social scientist, as an economist? So we basically model how the people are choosing their behavior, whether they are going to the workplace or not, taking into account the spread of disease. So that's what we do. So that's the contribution of the social scientists. So we built the quantitative model of internal city structure. We are looking at the Seoul, where there are 25 districts. So we model the individual decision by the age group, the young and the old, because the old are gonna face higher the health risk. And we also divide the week into the weekdays and weekends, because we found that the people are changing their behavior more during the weekend. I mean, that's very intuitive. During the weekdays, you should basically go to work. I mean, you can, it's hard to change the commuting behavior during the weekdays, but during the weekend, you can go to another district with a lower risk, or you can just decide to stay at home. And then we model the district differing in the productivity and amenities, and the workers have an option to stay at home, both during the weekdays and weekends. So we are modeling this individual heterogeneity, I mean, with the different age groups, and then combined with the local information provided by the government. So then that generates the self-selection. So then what model is predicting, which is the consistent to the data, is that the vulnerable population, the old, are gonna respond more to the information, especially during the weekends. So that's the model's natural prediction, which is consistent to our data observation. I'm gonna skip the parameterization. Then let me show you some of the simulation results. So we simulated the model first until the May 31st to compare that with the data, and then until 1,000 days after the first case of the COVID-19. So if you look at the left panel, so this is comparing what the model is predicting in terms of the number of the cases until the May 31st, and comparing to the data observation. So you see that there are 25 districts in Seoul, and there is a strong correlation between the model's prediction and the data observation. So saying that the model is doing a good job predicting the spatial, the spread of disease. So then given this model, so we are basically living in 150 day, around 150 day, and then we can simulate the model until say 1,000 days. Assuming that there is no development of vaccine. So, I mean, that's the huge assumption. I mean, with the development of the vaccine, the model dynamics is going to change a lot. But what the current model is predicting is that the Seoul is going to have the peak of disease around the 400 days. So that is going to be the next spring, sometime next spring, having, so say 1.5% of the old and then the 3.5% of the young being infected. So you already see that the old are infected less because they are voluntarily changing their commuting behavior based on the information. So there are many economic costs. So there is health risk, sure, I mean, that's the huge cost. And there is also economic cost because people are changing their commuting behavior, which is costly. And then the economic welfare declines. And then you see that my model is anticipating that at the peak of the disease, both the commuting flow and economic welfare is gonna decrease. So this one basically tells you why social scientists are working with a quantitative model, because we can do the counterfactual exercise. So I simulated the model of the Seoul having the information disclosure policy, but by having this quantitative model, what we can do is that we can do the counterfactual exercise, the meaning that what would happen without the information disclosure. That is the blue line you are seeing. So the y-axis here is the population share of the cumulative detected cases. So under the full disclosure scenario, our simulation is predicting that the less than 10% of the citizens are going to be the COVID-19 patients. But without the disclosure, that number is going to be much higher. That is going to be around the 12% of the Seoul citizen. So the change in the commuting pattern due to the public disclosure lowers the number of the cases and the deaths. The last point is comparison to the mandated lockdown. So I want you to focus on the two variables. I mean, I'm interested in, and many other policymakers are also interested in, the number of total deaths and the welfare loss, daily welfare loss. I'm comparing the two strategies, the Korea strategy, information disclosure, and this is the US strategy, the lockdown. And then where does the 25% and 100 days come from? So I want to do the apple to apple comparison. So this is the magnitude of lockdown giving me the same number of the cases at the end. So then we can do the apple to apple comparison. So you see that under the lockdown scenario, we have the higher the number of deaths, because under the information disclosure, the vulnerable population, they decide to stay at home. But under the lockdown, we don't basically discriminate the people by age or by their characteristics. And then the lockdown is much more costly because everyone is forced to stay at home. So the people are basically losing their wage and their utility during the weekend. But under the information disclosure, they can basically do their own the cost and benefit analysis and then decide whether they want to go outside or not. So that's why the welfare cost is lower under the information disclosure. So let me wrap up here. So I basically showed you the two advantages of the information disclosure. The first is the targeted social distancing, and second is the self-selection. And I showed that this information disclosure strategy reduced the spread of the virus while minimizing the cost of isolation. So that's it for my presentation today. But yeah, I will be basically happy to talk to you more about this Korea's experience.
Thank you very much, Dr. Lee. I'd like to open the floor to questions from our audience. We have the Q&A function at the bottom of your Zoom screen if you'd like to ask a question there. Or we can also turn the mic over to you if you let us know that you have a question, and we can let you ask your question as well. I have a question here, so let me see if I can. All right, there we go. You should be able, Pietro, to ask your question now.
Oh, fantastic. Thank you. Can you hear me now?
Yes, I hear you right.
Okay, great. Thank you. Thank you, Melissa. Thank you, Dr. Lee. So I think in the beginning of your presentation, you mentioned something like the districts that register a higher number of cases were disproportionately avoided by citizens. So how long so what I imagine is that there's going to be some equilibrium outcome. So districts that are visited less, people shift their, let's talk about weekend only. They shift their weekend behavior to districts that with a lower intensity of infection, but then because they hang out there, the intensity is going to be kind of average out upwards, right, in those districts. So I wonder how long is the spell of avoidance caused by the messages that people receive of hey, this district is really highly infected today? 14 days, or what do you see in the data?
Okay, so Pietro, that's very interesting question, and then that is related some institutional background. So that detailed information is only available for the 2 weeks on the official government webpage. And then, as you anticipated, sure, the people are caring more about the very recent information. So if you go to the mobile app, it only shows the recent a week or the 2 weeks information. So there was not much persistence in terms of the people's targeted social distancing. I think that's good because there was some concern the specific establishment has been penalized, because I mean, they did nothing wrong. So they were just unlucky. The patient visited that establishment. So their revenue has declined, say, for the next week, but then it went back to the normal. That's what I can see from, at least what I can see from the cell phone data. Melissa, you are muted.
There we go. Thank you. Do we have any other questions from the audience? You can ask them below in the Q&A, or you can ask them by raising your hand as well. I have a question. Oh, wait, no, sorry. We have one more question here. Great. Dr. Lee, can you see the question, or it's?
Oh, yeah, I can see the Q&A. So that question is from the Bailey. So to expand on the Pietro's question, as the dangerous districts are avoided, were there districts that were disproportionately hit economically, or did the case balance out over time? Okay, so it was unequal. So the geographical spread of disease and the number of the cases as the share of the population, as the share of the population, that was unequal. So we see more cases from the downtown, and then we see less cases from the commuter town. So the downtown districts were disproportionately hit economically, even though we don't see the persistent reaction to the specific information disclosure. On average, over time, we find the more and more cases from the downtown than other area. And it hasn't been balanced out. Yeah.
Do we have any other questions? I'd like to ask a question then. Can you talk a bit about the acceptance of these disclosure measures in Korea and whether people agree with the government doing this and some comments about the ethics of this data?
Yeah, that's a very important question, Melissa. So there is the privacy concern. Let me tell you one thing. So the Korea, basically Korea was I think the country with the largest case outside the Middle East when the MERS hit the global economy in 2016. So the Korea's reaction back then was not great. But after that, the Korea introduced the new law. So under the new law, so the detailed information of the patient is released under the national emergency. So this COVID-19 was actually interestingly the first case where the new law has been active. So the reason how the Korea could make that law is because the citizens realized the potential cost of the infectious disease by the MERS in the 2016. So there was the social agreement that even though it is costly, even though there is the privacy concern, the benefit outweighs the cost. So I think even in the US and other countries, it is the good time to start this kind of the same discussion. So my paper is showing that there is the benefit from the disclosing the information, but for sure there is the cost. So then by doing some cost benefit analysis or by having this conversation, yeah, it is the time to basically try to make some social agreement, whether we can apply the same strategy in other countries before the second wave of the COVID or another novel, the infectious virus.
Well, thank you very much. If we don't have any other questions from the audience, I'll go ahead and close our talk today. And we will have the recording of the talk along with Dr. Lee's presentation and a link to his paper available on our website and on our YouTube channel.
Okay, thank you for having me, and I look forward to seeing the outcomes from this interesting project. Thank you.
Wonderful. Thank you, everyone. Goodbye.